Wonderful. Thank you, Shariki. A very nice tour of a lot of substantial issues. And we're going to continue on that tour with the next speaker, Dr. Harriet Kuhnlein, Emeritus Professor at McGill University, continuing the discussion on cross-cultural insights, specifically what traditional cultures can contribute to resolving the obesity paradox. A nice duo here, I think.
Well, thank you, Rachel. And also thanks to Bill Purcell and Bill Dietz and the NASEM and all the roundtable and staff for making this workshop possible. I am really happy to be here. So I'm going to be talking about a subsection of traditional cultures identified as Indigenous people. And that has been my background from McGill University for more than 25 years. So I hope to share some of these perspectives with you. So the focus on Indigenous peoples will take this outline in general. Okay, so some background comments, some bits about prevalence within the United States, and prevalence of undernutrition internationally, obesity prevention, and what their experience might inform us for possible solutions. Now, in terms of trying to come to grips with how many indigenous and tribal people there are in the world today, we have to think about how data are collected. And this is usually done with census data. And unfortunately, many countries do not keep census data that is disaggregated by ethnicity. We're lucky here in the U.S. in this regard, in that we have on record with the CDC and the HHS about 5.2 million American Indian and Alaska Native people, and that's about 1.7% of our national population. But the UN has on record 370 million indigenous and tribal people in more than 90 countries. They form about 5% of the world's population, but they are amongst the poorest in the world's population, within 5,000 identified groups, and with obviously probably more than 4,000 languages, most of them endangered. So with Indigenous peoples, as with all of us, there is the rural-urban divide at about 50-50, if not rapidly becoming more urban all the time. But for understanding their food system knowledge and what it might offer us and our potential solutions, we look to the rural area for Indigenous peoples because of their connectedness to nature, and with the recognition that they at least used to be sustainable because they were there in those territories for hundreds, if not thousands of years. So the populations were sustainable with their food systems. And from the small amounts of information that we have with drawings and photographs on contact with populations, we recognize that most of these people were not obese. So what is it about these cultures that we can learn from? Food system knowledge of Indigenous peoples is derived from their collective experience in managing 22% of the world's ecosystems in today, on the planet today, and the land mass in them. It's in understanding the animals and plants in the world's forests, pastures, riverine lands and waters, lakes and seas, and also in recognizing that Indigenous peoples were responsible for preserving the majority of the planet's biodiversity and food diversity. But today, Indigenous peoples throughout the world globally face intractable poverty, racism, and discrimination. They have lower life expectancy and other health gaps wherever you look, in whatever country you're looking. They have less access to education, employment, good housing. There's more violence and incarceration. And it's recognized by the United Nations system that their marginalization is due to violation of their right to their traditional lands and territories. So this is Victoria Tolley Corpuz, the Special Rapporteur on the Rights of Indigenous Peoples in the Human Rights Council. And if any of you have any doubts about the infringements on the rights of Indigenous peoples and how they are being violated, just take a look at her website, if the National Geographic magazine isn't enough for you. So my experience with Indigenous peoples most recently is as principal investigator on a large study through our Center for Indigenous Peoples Nutrition and Environment at McGill. And we were looking at these 12 cultures in different parts of the world to understand their local food resources in a cultural context, and then to use some elements, at least some of those elements, for valorization of their culture to improve health and nutrition. So we used interdisciplinary teams and participatory research process with major leadership coming from within the communities. So we learned a lot about unique and delicious foods with surprising nutrient values, and that was one of my specialty interests, and I can tell you lots about that. And how these special foods are being lost to the massive global agricultural practices and food marketing that are finding their ways into these communities. So these two publications, with the help of FAO, are on the FAO website. They're each about 400 pages. They contain a lot of information. The one on the left, identifying the food systems and the cultural determinants and the other determinants that create them. And then the second publication, which went on for these communities and cultures to use those food systems for well-being. I also want to mention that the projects in the communities were very popular. I mean, in some health initiatives, outsiders are not very welcome into communities, but for these food system projects, people were very welcoming and understanding and sharing to bring forward this information. So this in the next slide just gives you some of the summary data, especially for the total number of species used as food by these cultures, the total number of wildlife animals within these species, and then you subtract the animals from total to get the plants. But you can see there are many, many different kinds of, well, you can't see the kinds, but the numbers vary a lot from upwards to 300 or so, more than 300 species, and the larger numbers are from areas that are tropical, obviously. So the research teams went further to collect dietary records so that they could get at some understanding of the percent of energy coming from the traditional local food. And that is what this slide shows, the percent of energy column there, and then a repeat of the number of species. So the dietary records were dichotomized, and they were dichotomized by the researchers in the field because the dietary records were taken in the local language or by microphone recordings. So the percent of energy reflects also the extent that these people are using their traditional food systems. Again, upwards of 90 to 95% for cultures in tropical areas. And two slides to show how beautiful these food systems are. This demonstration within the Karen community in Western Thailand, showing all of the plant foods that are harvested within one short season and prepared for visitors. And then here the traditional foods, some of the traditional foods from Micronesia. Upwards of 380 species within those small islands. It's really quite remarkable. Well, there are many social and economic drivers on the extent of use of this indigenous food system knowledge. And the risks for loss of this knowledge are substantial. Habitat destruction is the big one, ecosystem threats from resource extraction, from mining and oil exploration and harvesting of the oil and damming it, and putting it through pipelines, then the dams, the land grabs, climate change, contaminants. It's quite a long list, and climate change is really on everybody's mind right now because changes are taking place very rapidly. Displacement of people from their territory, loss of their language and culture, urbanization and migration, especially of youth, and the loss of knowledge that way, changing food acceptability and incorporating commercial foods into their transitions, and loss of seeds and wildlife. So what about prevalence of obesity? These are data that repeat, to some degree, what Shariki was showing us, the percent of obesity and overweight, as well as diabetes for our American, Indian, and Alaska Native adults in the first line there, the most recent data from CDC. And you can see upwards of 75% of our Indigenous peoples being obese and overweight, in contrast to the also not very great number of 61% of our non-Hispanic white population. But the diabetes rates are phenomenally larger, more than twice as much. Interestingly, the data for adolescents for both the AIAN and the white adolescents are reasonably close, and there's some research to be done there and to track how quickly these numbers diverge. The flip side, of course, in developing countries is malnutrition. And from the work of Anderson and colleagues in Australia, published in Lancet in 2016, we were able to summarize some of these numbers here for where they have good data, where census and health data are taken in Colombia, Brazil, India, and Peru. And you can see that stunting of children less than 5 years of age is much greater for Indigenous in contrast to the benchmark populations. And these are really good numbers when you think about India keeping records on more than 105 million tribal people in that country. So we do have indications that not only is obesity greater, but undernutrition, malnutrition, stunting is also greater. So we know that prevention is the key. It's the only way. And as a nutritionist, I commit to the energy balance approach, getting people to think about what they're eating, getting people to think about how much they are moving and exercising. But for Indigenous peoples, it requires a lot more than that. You have to go further than that. We've heard about systems. The systems approach is key, understanding the ecology and the environment of where the traditional home territory is of these people. And we also have to consider the complexities of micronutrient shortfalls and the needs for dietary diversity in this nutrition transition when they are actually losing a lot of their traditional diversity. But every culture is different. It's different for their food, and it's different for their physical activity patterns, as these two pictures show. But it's really, when we think about prevention, we have to think about self-determination. And it's the lack of self-determination that's the root cause of hunger and all malnutrition, not only for Indigenous people, but I'm sure for everyone. But with self-determination in place, we can move on, people can move on to assume their food sovereignty, to get to sustainable food systems, to food security, onto sustainable diets and sustainable healthy people, which is where we are all wanting to head. So how do we go about building the capacity for self-determination? And I'll reiterate what Shariki said about trauma, because we really cannot underestimate the significance, the profound significance of the lasting traumas of colonization on Indigenous peoples. And it has all aspects on all parts of their health and well-being. I just came from a conference in Minneapolis on Native American nutrition and realized that there, in all communities of Indigenous people today, there are grandparents that were exposed to this colonization and the forced boarding schools and so forth being taken away from their parents. So that trauma is with all of our reservations today. But building self-capacity, we need to use community-specific information as a platform for health promotion, understanding, and activities. And we need to recognize and respect the Indigenous ways of knowing and being to support sustainable well-being for their decision-making, policy, and action. And it's important to recognize the global megaforces that undermine Indigenous cultures. So there is a place for reductionist approaches, but there's also the need for holism and social understanding. And when we look at both sides of energy balance, here I'm stressing the dietary side. And it's important for us to understand and to help the communities to understand their foods and their dietary intake, and to understand the impact of commercial foods and their nutrition transition. The NOVA classification that Fabio was talking about is important for helping people to understand their diets and the impact of processed food. But there's also the impact of dietary diversity and the contexts of cultural food diversity that are part of the need for education and awareness of these communities. But never ignore the fact that the impact of our education and awareness can be swamped out by the larger ecological factors such as poverty or food access. If you visit some of the reservations, you understand what it's like to be living there and to be buying food there if you need to buy food. Now, Delermier and colleagues in a recent issue of Maternal and Child Nutrition put forward these points of view on how to face the challenges and how it needs interdisciplinarity in understanding and dealing with Indigenous peoples' obesity. First of all, the need to decolonize public health programs to express the holistic Indigenous worldviews for preventing obesity and undernutrition. Use the Indigenous values of respect, responsibilities, and relationships to each other and to nature. Recognize locally specific conditions and the broader historical, political, cultural, economic, and environmental context that people are dealing with, and build the Indigenous public health workforce to promote well-being that's based on human rights, and rebuild cultural morale with local practices. So when working with Indigenous people, it's important to understand their connecting to nature, their deep and long-standing knowledge of ecosystem provisioning. In Micronesia, one of our programs developed this school program for appreciating bananas. There are upwards of 30 different varieties of bananas in those small islands of all different flavors and colors and some outstanding nutritional values. But Indigenous peoples understand that food use touches everything. Food use touches local cultural traditions, but it affects all aspects of health, the mental, physical, social, and spiritual aspects of health and well-being. So the way forward, how can Indigenous peoples' experience inform us? I feel it's important to document the diversity of Indigenous peoples' food systems and learn from it, understand the unique species, diversity, cultivation, harvesting, preservation practices, taste and use, composition values, and the dietary diversity. and especially in the local, but also in the regional thinking. And also to document Indigenous health strategies as well as strategies for physical activity. So all of the knowledge that Indigenous peoples have has developed from ecosystem services, right? From land, food, air, and water, and their understanding and appreciation for that. And we also have the many social determinants within their cultures as well as has been imposed on them. So we need to build an international knowledge platform of traditional and Indigenous holistic food system and health system knowledge with ecological sustainability. And it's important for all of us to recognize the value of expanding knowledge and intercultural education. There's important words there, intercultural education, for resolution of the obesity pandemic affecting all populations. And this is important for all of us that work in public health, but also for all professions that are dealing with Indigenous peoples and their circumstances. Thank you for your attention.